Let's pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants, whom you've been pleased to call to the performance of internal trust in this republic. Let your blessings descend upon us here assembled. Grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interests you've committed to our church. Amen. Honorable members, I want to refer ourselves to standing order number 32. Direct that the quorum bell be rung for the first 5 minutes. Seeing the majority whip, neither the deputy majority whip, so Honorable Nerea, the deputy speaker, maybe you can whip the members who are out. The quorum bell be rung for a further 5 minutes.
Baba.
Honorable Raya, can you confirm if you are...
Yes, Mr. Speaker, we have quorum.
Clerk, take us through the order.
Order paper number 221 of today, Wednesday, 28th August 2024 at 9 a.m. Order number 1, administration of oath. Order number 2, communication from the chair.
Next order.
Order number 3, messages. Order number 4, petitions.
Next order.
Order number 5, papers.
Leader of majority.
Mr. Speaker, I wish to lay the following. Pursuant to provision of Section 7, Paragraph 1 of the Public Appointment County Assembly Approval Act number 5 of 2017, I wish to table today, Wednesday, 28th August 2024, the notification of nomination for appointment of Mr. Nation Otieno Aluoka to the position of the county attorney. Thank you, Mr. Speaker.
Honorable members, the nomination of National Worker to the position of county attorney is properly laid before the House. And I want to direct that the committee of appointment considers the approval process or the vetting process as per the County Assembly's Approval Act and the standing orders. Honorable Nancy.
Yes, Mr. Speaker, to the person to the provision orders number 182-6 of the standing orders, I wish to table today, Wednesday, 28th August 2024, the report of Sports, Culture and Youth Affairs Committee on the status of various culture sites and footballs within the county, football pitches within the counties. B, the benchmarking exercise at Uasin Gishu County Assembly.
Honorable members, there are two reports from the Committee of Committee on Sports, Culture, Gender and Youth Affairs. That is the report on benchmarking exercise with the Gishu County Assembly, and this report on the status of various cultural sites and football pitches within the county are properly laid before the House, and I direct that the House Business Committee considers them for purposes of scheduling for debate. Next order.
Order number 6, this is motion.
Honorable Speaker, report of the Sports, Culture, Gender and Youth Affairs Committee that are pursuant to the provision orders number 45-1 of the standing orders, this House adopts the reports of Sports, Culture, Gender and Youth Committees on the status of various culture sites and football pitches within the county.
Next order.
Order number 7, statements.
Next order.
Commencement of business. Order number 8, motion. Adoption of the report of Medical Services, Public Health and Sanitation Committee on the status of Rata Health Center and Rito Langis Dispensary in Seme Sub-County.
Honorable Emily Oginga.
Mr. Speaker, I'd like to move this motion on behalf of my chair, who is away.
Proceed.
I'd like to, Honorable Speaker, I'd like to move the motion on the report on the status of the Rata Health Center and the Rito Langi Dispensary in Seme Sub-County by the Sectoral Committee on Medical Services, Public Health and Sanitation. Honorable Speaker, orders number 194, 194-2B vests the responsibility of preparing programs on the House committees, and in light of this, the Committee on Medical Services, Public Health and Sanitation Committee developed this annual work plan for the financial year 2024-2025, where among its listed activities for the year was to conduct field visits to healthcare facilities, to assess service delivery pursuant to standing orders number 193, 5E. At its sitting of Thursday, 2nd of July 2024, that is referred to Annex 1, the committee resolved to carry out surveillance exercises to the health centers within the county in a dedicated effort to ensure enhancement of healthcare services offered and seamless functionality, and developed a program thereof, that is referred to Annex 4. And with the authority of the Honorable Speaker, the committee conducted surveillance exercise at Rata Health Center and the Rito Langi Dispensary on 17th of July 2024 to get first-hand understanding of the services offered at these facilities, the general operations, and identify areas for improvement to enhance efficient, sufficient, and quality healthcare provision to the citizens of Kisumu County. Honorable Speaker, the challenges faced by the facilities were: the committee established that these facilities are facing several challenges that hinder their attempts to operate optimally and provide sufficient services. These the committee categorized into two. That is, the first one is the specific challenges. At Rata Dispensary, the first challenge was lack of proper staff motivation and rewarding mechanism. The committee recommended, on this challenge, the committee recommended that the Department of Medical Services, Public Health and Sanitation should implement a performance-based reward system that recognizes and rewards outstanding contributions from healthcare workers, which would include bonuses, promotions, or other incentives based on key performance indicators. The second challenge was the risk of insecurity due to improper fencing. Services should inspect the facility's fencing, assess its security, vulnerabilities, and implement a temporary solution until funds can be secured for permanent perimeter fencing. The third challenge was an unsupported dialogue days, action days, ward meetings, and facility meetings. The committee further recommended that the Department of Medical Services, Public Health and Sanitation should allocate adequate resources and provide training to staff involved in organizing and facilitating these events, and ensuring that they are productive, informative, and contribute to improved service delivery. The next challenge was inadequately equipped wellness center. The committee recommended that the Department of Medical Services, Public Health and Sanitation should conduct a needs assessment of the wellness center and invest in upgrading the equipment to provide a wider range of services and better the needs of the community. Mr. Speaker, sir, on the second facility, that is the Rito Langi Dispensary, The committee noted the first challenge as lack of laboratory reagents, that is the SAT, RBS, TICS, and HB. And the committee recommended that the Department of Medical Services, Public Health and Sanitation should implement a more efficient procurement and supply chain management system for laboratory reagents, ensuring that essential items are consistently available and that there are backup plans in case of supply shortages. The second challenge within this facility was the lack of functional maternity. The committee recommended that the Department of Medical Services, Public Health and Sanitation should consider submission of a proposal for establishing a maternity in the facility now that the facility handles maternal cases. The third challenge within this facility was understaffing. And the committee recommends that the Department of Medical Services and Public Health should develop a comprehensive human resource plan, including recruitment, training, and retention strategies to ensure that the facility has adequate staff to meet the needs of the community. And the second section of the cross-cutting challenges, Mr. Speaker, the committee also established that below are the challenges that cut across these two facilities. The first one is that the facilities face the challenge of understaffing. The second one is that there is an erratic supply of essential drugs and reagents. The third is that the facilities face severe underfunding that has led to delay in payment. On the general recommendations, Honorable Speaker, the committee therefore makes the following recommendations aimed at improving healthcare delivery provision in these facilities. The committee therefore makes the following recommendations. That is, number one, that during this visit, the committee observed that the healthcare facilities are facing significant financial challenges due to insufficient funding. The current allocation of 75,000 shillings is inadequate to support the operations for an entire financial year, particularly considering that they do not charge user fees for their services. To address this issue, the committee urges this Honorable House to reconsider the funding allocations to these facilities in the upcoming budget cycle. This would ensure that these vital healthcare institutions have the resources necessary to provide quality services and pay their casual staff on time and meet the healthcare needs of their respective communities. The second recommendation is that the challenge of inadequate staffing has been a recurring issue in all the reports that the committee has presented before this House. Therefore, the committee recommends that the Department of Medical Services, Public Health and Sanitation, in collaboration with the Kisumu County Public Service Board, should submit a comprehensive report detailing the current status of healthcare recruitment efforts, including any planned recruitment drives or initiatives, as well as the estimated budgetary needs for the upcoming fiscal year, to ensure adequate staffing levels at healthcare facilities in Kisumu County. This report should be submitted to the committee within 1 month upon receipt of this report. And the third recommendation is that the Department of Medical Services, Public Health and Sanitation should establish a more efficient procurement and supply chain management system for laboratory reagents to ensure that essential items are consistently available and that there are backup plans in case of supply shortages. Acknowledgement. Mr. Speaker, finally, I take this opportunity to convey the committee's utmost gratitude to the office of the Speaker and the Clerk of the County Assembly, its members and the Secretariat, not forgetting the management of Rata Health Center and Arito Langi Dispensary for their support, dedication and cooperation before, during and after this exercise that ensured its success all through to the point of production of this report. It's therefore great honor and privilege on behalf of the committee to move this motion that this House adopts the report of the Medical Services, Public Health and Sanitation on the status of Rata Health Center and Arito Langi Dispensary in Seme Sub-County. Thank you, Mr. Speaker. And I call upon Honorable Nereo Kombo to second.
Thank you, Mr. Speaker and honorable members. Mr. Speaker, I take this opportunity to second the report of the Health Committee in regards to our visits to Rata Health Center and Arito Langi Dispensary. Mr. Speaker, usually committees visit on statements raised from this house on a problem on the ground. But this Kisumu County is blessed with a proactive committee in the name of a health committee that, Mr. Speaker, we do not wait for problems to arise, Mr. Speaker. We took an initiative to visit, to find out any challenges that our facilities that serve as the primary points of offering health to our people, to ascertain the challenges that they may be having and find possible solutions, Mr. Speaker. Mr. Speaker, what stood across all the facilities that we visited was that, Mr. Speaker, even though these facilities have drawing rights from KEMSA, KEMSA do not supply medicine and other requirements as requested by these facilities, Mr. Speaker. Some requested like 6 months ago, and to date, those supplies have not been delivered to these hospitals. At times, they request for antibiotics, and they get painkillers instead, Mr. Speaker. Mr. Speaker, in some facilities like Ritolangi, we did not even find ORS, Mr. Speaker, because they had requested and KEMSA had not submitted. Mr. Speaker, I know the county pays KEMSA to deliver drugs and other non-pharmaceutical equipments to our facilities. But if they are not delivered on time, Mr. Speaker, then services is hampered in these facilities, considering that these facilities do not charge for services. And Mr. Speaker, it is my plea to this House to adopt this report, that these facilities may be equipped as we have recommended, so that our people may get the services that are so desired by our people, because before they get to facilities like KDH, Lumumba, or JOTRH, then they first attend these facilities before they get referred. So, Mr. Speaker, these are the very primary health provider facilities that we have, and when well equipped, Mr. Speaker, then our people will not even need to jam JOTRH or KDH for services. So, Mr. Speaker, I second. Thank you.
Honorable members, now that the committee of Health have moved a motion adoption of the report of Medical Services Public Health and Sanitation Committee on the status of Rata Health Center and Arito Langi Dispensary in Seme Sub-County. The motion seconded. I want to propose a question. And I propose that the motion adoption of the report of Medical Services, Public Health and Sanitation Committee on the status of Rata Health Center and Arito Langi Dispensary in Seme Sub-County is open for debate. Honorable Ratib Boyton.
Thank you. Honorable Speaker. Honorable Speaker, I want to contribute on the motion that is on the floor. Honorable Speaker, a few days ago, there was a motion that similarly will be linked to what we are discussing today. When Honorable Koyo's mother was taken to JTRH, and one of the issues that came out from that motion is that the county government to empower the facilities that are located within the wards. That is the health centers and the dispensaries. This shows why patients will flock at the county hospitals, because they don't get services at the dispensaries and health centers within the ward. These challenges, Mr. Speaker, it's not the first time we are getting them in the floor of this House. Several times we've been mentioning lack of drugs, essential drugs, within our facilities, within the wards. And up to date, nothing so far is forthcoming. Mr. Speaker, it is very important that upon adoption of this report, the Department of Medical Services look into this issue and push for essential drugs within our health facilities. Mr. Speaker, another challenge that has also cut across is the lack of funds to run these facilities. I don't know where the county government will get funds to vitalize these facilities, because most of the time we are always inadequate of the funding of these facilities. Let the executive, let the county government look for funds anywhere they can get these funds, so that issues of lack of funds here and there should be a thing of the past. That also combines with the lack of laboratory agents and things of that nature. Mr. Speaker, casual workers. We realize and we know that the casual workers in these facilities do great job. And non-payment, let alone delaying of payment, should not be an issue here. These dedicated Kenyans should be paid on time so that they are encouraged to continue servicing our people. And on the same, Mr. Speaker, motivation. We realize that most of these facilities are understaffed. If that is the case, I believe motivation of this, the staff who are in place will make them work more, and that will enhance service delivery in our health facilities. Mr. Speaker, I believe upon adoption of this report, the county government, through the Department of Medical Services, will try as much as possible to address the challenges so that our people get basic health care from our health facilities. I support, and I support 100%, Mr. Speaker. Thank you.
Honorable Ken Ouko.
Thank you, Mr. Speaker. I stand here to support the motion. Having read the content and heard the presentation in the House. Mr. Speaker, the lowest unit when it comes to health care, provisions of health care, it is the dispensary. I understand there is also another unit for community health workers. It is also considered that as the first point of intervention when there is a problem in terms of treatment. Mr. Speaker, these are the facilities which are serving many of our voters, many of the constituents of Kisumu County, and the poor who cannot talk, who cannot afford to get to level 3, level 4, level 5 hospitals. Mr. Speaker, is it now that we are confirming that the Facility Improvement Act has failed? Because that was the essence of coming up with these regulations, to take care of small facilities. They can manage themselves, they can buy drugs, they can do several things with the money plowed from the management, and they get it back to the facility. Mr. Speaker, it is quite unfortunate that even the casuals, at times, they are not being paid. And we have the Facility Improvement Act, which was passed by this House. Mr. Speaker, there must be a problem with our health system within the county of Kisumu. Why must we overfund Jaramogi and leave the poor down there? The bigger chunk of health funding should go to the lower level where we have dispensaries. The moment we fail and focus more on big hospitals, Mr. Speaker, we are going to fail to serve our own people. It is always advisable that we focus more on the local person, which is back at home. Mr. Speaker, if we can concentrate and fund these facilities back home, we will achieve, and we will be appreciated as the representative of the people. Therefore, Mr. Speaker, I think there must be an oversight in the part of the executive by giving preference to big hospitals and leaving small hospitals. And we should also insist and relook into the Facility Improvement Act so that it serves its purpose, Mr. Speaker. Thank you, Mr. Speaker. I support.
Honorable Seth Okumu.
Thank you so much, Honorable Speaker. I rise to support this report by the Committee on Medical Services, Public Health and Sanitation. Honorable Speaker, how I wish the members in which these two facilities were present so that they can take note of some of the observations that were made by the committee and they can use in the planning for annual development programs for the specific wards. Honorable Speaker, I want to mention as a member of the committee that the effort taken by the Committee on Medical Services, Public Health and Sanitation is the best public participation that we can have. Honorable Speaker, everybody has been asking, does Kisumu County Assembly do oversight? And if you read what they believe is oversight and what they appreciate is oversight is when this House rejects any proposal brought before the floor. But the Committee on Health is proving otherwise, that we can go to these facilities, sit with members who are providing services in these facilities, get information from them, observe what's there, bring a report in this assembly, implore on members to adopt the report, and follow up on the implementation of the same. Honorable Speaker, we've been struggling to adhere to World Health Organization standards. But when you visit these facilities and you see the workload that they are having, sometimes we might not need to match what the World Health Organization require. But just additional staffing can have a big improvement on service delivery in these facilities. If you get the numbers that we are seeing, for example, in Rata, with in 2023, for example, they had 860 ANC clients, 976 FP clients, 1,144 males for OPD, 710, 1,144 females in outpatient department and 710 males. Then we also have postnatal clinic of 373.
if you are asking the staff in that facility that what's the number of additional staff you need for RATA to perform optimally. And they were suggesting that with just 2 clinical officers, 2 farm techs, 2 lab techs, and 4 nurses, they will be better placed to serve those numbers that are talked about in terms of patients that visit the facility. It might be different from what the World Health Organizations recommend, but it's suitable and applicable in our situation. So, Honorable Speaker, the report that we are submitting in this House gives standards for Kisumu County in terms of staffing of our facilities, as seen with the numbers of patients they see and recommended by the staffs in those facilities. And this goes to even the equipment that they require and the kind of services that they offer. Honorable members, we are today bringing the report on RATA and Arito Langi. RATA being a health center and Arito Langi being a dispensary. And you'll find that this is repeated in several other dispensaries and health centers that we're having in the different wards. This report alone can be guide honorable members in making decisions about the dispensaries that we have not visited. But the committee has not finished visiting these facilities. We are still continuing to see more facilities, and we'll be bringing a report in this House. We believe by the end of this year, we shall be having a comprehensive report that we can generalize on all dispensaries and health centers that can help us make a very informed budget on these facilities come the next financial year. Honorable members and Mr. Speaker, we have mentioned that we have always procured our drugs using KEMSA. If you visit these facilities, you see the challenges that they are facing with such kind of arrangement, and we've made recommendations on what we should do in procuring drugs. Honorable members, if you visit, for example, Arito Langi, it was mentioned that the request that they make to KEMSA sometimes is different from the drugs that are delivered to them without explanation. Honorable members, this brings a big challenge because we are not sure, and they are not sure, that when it comes to payment, is the payment done with the request they made, or payment is done with deliveries that KEMSA did to those facilities? Those are some of the concerns that I believe this report is bringing out that need to be investigated further so that we can make proper recommendation in terms of procuring of drugs in Kisumu County. Otherwise, Honorable Speaker, I support the report.
Honorable Alice Wajeo.
Thank you, Mr. Speaker. I rise to support the adoption of the report, of this report by the Committee of Medical Services. And I want to congratulate the committee for the good work they've been doing. I also want to attest that the Committee of Medical Services have been doing a very good job in this county. They have been visiting several facilities, health facilities, that is the dispensary and the health centers. And they have come up with so many challenges, some which are highlighted here. And these challenges, they cut across almost all the health facilities in the county. Their recommendations are also very good. In fact, they are just more or less the same. Like the one they have said that we should be recognizing our health workers, especially our community health workers who are doing a very good job in our health centers, and even other health workers in the facilities. They are really working under very, very difficult situations. Their health facilities, like the ones they have mentioned here, are not well fenced. They don't have enough drugs. they don't have enough non-farm materials and equipments to take care of the patients. And you know, sometimes it is really frustrating to work under those kind of conditions. So if really come up and maybe recognize them and motivate them, they would really do a very good job. And this issue of security, especially the fencing of our health facilities, it is really important because, you know, these days there's a lot of insecurity in our county due to high unemployment. Our youths are not employed, and they don't care whether you are a patient or whether you are sick, like the case we had in Lumumba Health Center, where they went into the hospital and harassed the patients who are there. So if the relevant authorities can take these recommendations from the department seriously and provide security, motivate the health workers, provide medical equipments and medicine to our health facilities and even laboratory reagents, it will really reduce the mortality rate of our people in the county. So, Mr. Speaker, I just want to support again, and I also want again to appreciate the work the committee has done, and they should, other committees should, they should be an example to other committees. Thank you so much.
Honorable Henrietta Bodo.
Mr. Speaker, I also arise to support the medical report that they have brought before the House. Mr. Speaker, we all know
that it's a medical committee report, not a medical report.
Thank you, Mr. Speaker. Obliged. Mr. Speaker, we all know, as a House and as members of the public, that the first health facilities that are closer to the people are these ones we are talking about. These facilities are first-line facilities for members of the public. And if they are not well equipped and well funded, Mr. Speaker, we are not decongesting the other level 4 or level 3 facilities. And so in this case, the fund allocated to these facilities should be looked at. And the 75,000 that the report, the committee has brought before us, Mr. Speaker, is not enough. 75,000 is way much less than what a facility would have for every financial year, Mr. Speaker. And I think we need to relook at the allocation of this allocation for these facilities, so that if there is anything to do about it, as in the increment of the funding, then we need to do it as soon as possible. Mr. Speaker, the other time we spoke about decongestion of level 4 and level 5 hospitals. And we cannot decongest when we cannot actually have these lower cadre health facilities well funded and having workers in place. If we want really to decongest the other health facilities, the upper cadres, then we really have to equip the lower health facilities so that we prevent people from moving up there unless it's referral. Mr. Speaker, otherwise, I would like to thank the committee for health, for the report they have brought. I think it is a very straightforward report that any would look at and support. The recommendations are well put, and so I stand to support the report. Thank you, Mr. Speaker.
Honorable Bill Oliver.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, we have a very good committee of health, and I want to thank them for a report like this, because this is a report giving us a clear picture of what is really happening as members, so that in our legislative role, we can do our work well. Mr. Speaker, from the report, the two medical facilities, you can realize from the previous reports that we've had, Mr. Speaker, we have challenges that cut across. Mr. Speaker, the funding that these facilities get, because they are not making profits, is they get it from Danida, and Danida is going to phase out, and I'm worried if it is going to phase out, does the department have other plans of consulting and maybe getting other agencies that can help to fund our facilities, because they are not making profit. And if that fund is going to be stopped, it means nearly all these facilities will stop operations. And again, you realize that it is these facilities depend on Danida to even pay the casuals. Mr. Speaker, another thing that I want to say is that as members of the County Assembly of Kisumu, we should have, rather the committee should have a way of consulting with the executive, so that at least we sensitize of our people on at least having medical insurance. Because you realize that institutions that are not making profits, when they don't get the funds, it means our electorates, or rather Kisumu County members, don't get the medical services that they deserve. And if we encourage them to have at least the NHIF and the other medical insurances that are there, we'll at least reduce the risk of our people not getting the medical services. When we started the third assembly, we had a meeting, Mr. Speaker, with the executive, and if you realize what they told us, they wanted to develop at least one facility in every ward. I think from this report, we should also have, the committee should also consult with the executive line department, so that at least we get to know the progress of that program that they had in every ward, so that we know what facility has been developed in which ward, and which wards have not been serviced yet. Because, Mr. Speaker, if that program worked, it was the spoke system. If it works, it means one facility in every ward will be well equipped, and probably will have drugs. And so that if we have not developed all the other facilities in every ward, at least that one, members from that ward can depend on that when the county is still developing all the others. Thank you, Mr. Speaker. I support the report.
Yes, Honorable Henry Obasa.
Thank you, Mr. Speaker. Mr. Speaker, I think everyone has exhausted their points, and I want to call them over to reply. Thank you.
Honorable Emily?
Thank you, Mr. Speaker. First of all, I'd like to appreciate the House for supporting this document. And as we know that health is a key pillar of development of this county. And Mr. Speaker, I'd like to appreciate our committee. The Committee of Medical Services, Public Health and Sanitation is a very active committee. And members, as you can notice that the committee is already working on their current work plan. I know it's the first committee to bring a report to the floor of this House on the current work plan. I'd like to appreciate this committee of hardworking honorable members, because as we are carrying out this visit, it was during the recess, and you know during recess usually we get a bit busy with the electorate. Mr. Speaker, secondly, I'd like to let the House know that this report actually has 3 key issues that were picked by the committee that most of our facilities are facing. That is financing, staffing, and supply of medical drugs. And Mr. Speaker, I'd like to mention what Honorable Ouko talked about on the evolving services to our lower level facilities. As we all know that we've been trying to process, Mr. Speaker, help me, protect me, because Honorable Ratib is sitting next to me here and is distracting me.
Honorable Ratib, what is the issue? Are you on a point of order?
Thank you, Mr. Speaker. Mr. Speaker, like we all know, like I was just saying that we all know that the OTRH is a level 5 facility that serves not only Kisumu County, but also the entire region, Western region. And you know we've been having issues on funding because the OTRH is overwhelmed with offering services to other counties who actually don't finance the facility. So you find that most of our finances go into JOTRH, and we end up neglecting our lower level facilities. And that is the reason why we are lacking funding for most of these level 2, 3 facilities. So I hope that with the time, as we work on handing over JOTRH to the national government, then we'll be able to have more finances to equip most of our lower level facilities and decongest JOTRH and let our people be able to access facilities at the lower levels. And Mr. Speaker, just like one of my colleagues mentioned, that there's a gap in medical supplies follow-up. As we were going around these facilities, we noticed that there's a very big gap in following up on the supply, because what the facilities request usually is not supplied to the letter. So we are still carrying out our oversight role on finding out where the gap could be and why the facilities don't really get the quantity of supplies that they request for. And maybe we'll be able to bring the report back to this House and have that corrected. Mr. Speaker, one of the honorable members, that is Honorable Billy, mentioned insurance. Mr. Speaker, I'd like to encourage honorable members to encourage our people to register for this insurance, because most of these facilities actually rely on reimbursement from the insurance. You find that most of our health centers and dispensaries don't charge anything for the services offered. And when someone goes to the facility and doesn't have insurance, it means that that is a service that is offered with no return at all. So when our people have an HIF, or maybe the new one that is coming in, then we'll be able to have the facilities able to make claims and increase their funding for their services. And Mr. Speaker, as I finish up, I'd like to encourage other committees to emulate what this Committee of Health is doing, so that they can also rush with their work plans for this financial year and bring quality reports that actually bring the true picture of the status of our county. Otherwise, thank you, I reply.
Honorable members, now that The motion, adoption of the report of the Medical Services, Public Health and Sanitation Committee on the status of Rata Health Center and Arito Langi Dispensary in Sub-County have been moved, seconded, debated. As per our standing orders, I want to put a question. And I put that as many of the opinion that the motion adoption of the report of Medical Services, Public Health and Sanitation Committee on the status of Rata Health Center and Arito Langi Dispensary in Sebe Sub-County be adopted, say aye. As many of the contrary opinion say nay. The ayes have it. And the motion, adoption of a report of Medical Services Committee, Medical Services, Public Health and Sanitation Committee on the status of Rata Health Center and Arito Langi Dispensary in Sebe Sub-County have been adopted today, Wednesday, the 28th of August 2024 at 10:06 hours. And honorable members, I want to direct that the recommendations of the report be communicated to the relevant departments for action. And the implementing committee, I think I saw the chair of the implementing committee in the House, to follow up on the implementation of the recommendations. But also, let me remind all the honorable members that tomorrow, Thursday, the 29th of August 2024, we shall be having the County Executive Committee member for Health and the CEO of Jaramogi Odinga Teaching and Referral Hospital here during the General Oversight meeting. I think it could also provide an opportunity to present some of the recommendations as discussed today. So the meeting is there tomorrow during the General Oversight meeting between the CEO, Jaramogi Odinga Teaching and Referral Hospital, and the County Executive Committee member for Health, and all the members of County Assembly, as was resolved in the last General Oversight meeting in the last Thursday. Honorable members, with that, we move to the next order. Clerk, next order.
Mr. Speaker and honorable members, there is no any other business in the order paper.
Standing, honorable members, there being no any other business in the order paper, the House stands adjourned until today, Wednesday, 28th of August 2024 at 2:30 p.m.